Magnesium Aspartate Hcl Tablet, delayed release, Enteric Coated, is a mineral supplement that helps to prevent and treat low levels of magnesium in the blood. It can also be used to treat symptoms of too much stomach acid, like stomach upset, heartburn, and acid indigestion. Magnesium is essential for the normal functioning of cells, nerves, muscles, bones, and the heart. While a well-balanced diet usually provides enough magnesium, certain situations can cause your body to lose magnesium faster than you can replace it from your diet. These situations include treatment with water pills, diuretics like furosemide, hydrochlorothiazide, a poor diet, alcoholism, or other medical conditions such as severe diarrhea/vomiting, stomach/intestinal absorption problems, and poorly controlled diabetes. It's important to take this medication as directed by your doctor. The usual dose is 1 tablet daily. The best time to take it is with a meal to help with absorption. When taking this magnesium supplement, be sure to follow the instructions on the product package. It's best to take it with a meal to avoid stomach upset and diarrhea, unless directed otherwise by your doctor. Make sure to take each dose with a full glass of water, and do not crush or chew the tablets or capsules unless instructed to do so. If you are using the liquid form, be sure to measure the dose carefully with a medication measuring device. It's important to take this medication regularly at the same time each day in order to get the most benefit from it. The dosage is based on your medical condition and response to treatment, so be sure not to increase your dose without consulting your doctor. If you experience symptoms of low magnesium levels, such as muscle cramps or tiredness, be sure to inform your doctor. And if you think you may have a serious medical problem, seek medical help right away. If you experience stomach upset or diarrhea, taking this medication with a meal can help reduce these effects. If these symptoms persist or worsen, consult your doctor or pharmacist. Remember that your doctor has determined the benefits of this medication outweigh the potential side effects. Most people using this medication do not experience serious side effects. While a severe allergic reaction to this drug is rare, seek immediate medical attention if you notice any symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you experience any other effects, consult your doctor or pharmacist. It is important to take this medication as directed by your doctor for optimal benefits. If you have any concerns, consult your healthcare provider. Before using Magnesium Aspartate Hcl Tablet, delayed release, Enteric Coated, make sure to inform your doctor or pharmacist if you have any allergies or kidney disease. Some forms of this product may contain sugar, aspartame, or alcohol, so it's important to use caution if you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet. If you are pregnant, only use this product if it's clearly needed, and discuss the risks and benefits with your doctor. It's not known if this product passes into breast milk, so talk to your doctor before breastfeeding. It's important to be aware of potential drug interactions with Magnesium Aspartate Hcl Tablet, delayed release, Enteric Coated. This can affect how your medications work and increase your risk for side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's important to not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include cellulose sodium phosphate, digoxin, and sodium polystyrene sulfonate. Magnesium can bind with certain medications, preventing their full absorption. For example, if you are taking a tetracycline-type medication, you should separate the time of the dose from the time of the magnesium supplement dose by at least 2 to 3 hours. If you are taking a bisphosphonate, a thyroid medication, or a quinolone-type antibiotic, ask your doctor or pharmacist about how long you should wait between doses and for help finding a dosing schedule that will work with all your medications. It's important to check the labels on all your prescription and non-prescription/herbal products, such as antacids, laxatives, and vitamins, because they may contain magnesium. Ask your pharmacist about using those products safely. If someone has taken too much of this medication and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek emergency medical help right away. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include a slow heartbeat, severe drowsiness, dizziness, confusion, muscle weakness, and loss of consciousness. It's important to have regular medical tests to check your magnesium levels and kidney function while using this medication. Be sure to keep all of your medical appointments and consult your doctor for more information. Magnesium supplements come in various forms and strengths, and some are available without a prescription. It's best to consult your doctor or pharmacist to find the right product for your needs. In addition to taking the medication, it's also important to maintain a balanced diet. Foods that are high in magnesium include avocados, bananas, beans, whole grain cereals, green vegetables, and nuts. If you happen to forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Do not take double the dose to make up for the missed one. Make sure to store this medication at room temperature, away from light and moisture. Keep it out of reach of children and pets, and do not store it in the bathroom. When it comes to getting rid of this medication, don't flush it down the toilet or pour it into a drain unless you've been told to do so. Instead, make sure to properly discard it when it's expired or no longer needed. If you're not sure how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.